Welcome to Pediatrics by Dr. Anand. Today, I am very sure that my voice should come and my face and my everything about me should come. Is my voice coming to everyone? Please let me know in the comment section. Thank you. We're gonna start the class now. Today, after 2 days of back-to-back, no voice coming. Today, my face and voice both should come. Is it coming? Yes or no? Put your answer in the comment section. Thank you. Thank you, thank you, thank you, thank you, thank you. Yes, I hope my voice is coming. Hello, Akshay. Hello, Osama. Hello, beautiful people. Is my voice coming? I'm gonna start. Oh, yes. Now it's coming. Now it's coming to me also. Now you can't say, no, sir, no voice. Please, could you repeat again? Okay, perfect. So after 2 days of Kashmikash, we had the issue and now it is resolved. Okay, let's start. Hello everyone, welcome to Pediatrics by Dr. Anand. This is the beautiful Unacademy NEET PG platform and we're going to start the class in this beautiful Unacademy NEET PG. I hope you all are guys giving this such amazing beautiful test we are having in the NEET PG. From April, this is the last month of April, just 2 more days and this beautiful month is coming to an end. So we have this physiology, microbiology, obs gynae by Dr. Ankit Khandelwal and many people. We have this beautiful test. I hope you guys are giving right. Yes, Salvation says yes sir, face and my Awaz is also coming. Great. We have this All India mock test happening on May 1st at 9 a.m. I recommend every one of you to give as many tests as possible. It will be great if you give some amazing tests. Also, just one more day left for the Unacademy goal. From April 25th to April 28th, you have this 20% off on the all subscriptions. Usually we don't get such off. All you have to use is use the code Dr. Anand if you want to avail this offer. If you don't want to avail also, no problem. I will teach you something nice. Also at the same time, for the MBBS students pertaining to the next exam, we have some beautiful stuff coming up for the duration. This is the duration of the plan, the price and the pre-launch price. This is something which is important, like you're starting the career and also the next is coming. So let's start your career in a very beautiful way. Also at the same time, in the Unacademy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription, get amazing access to all the live and recorded classes. Educators is nice, quiz is of good quality, and you can watch on any device you want, and some amazing 25,000 MCQs we have. Also, we have the Plus subscription. In the Iconic subscription, you get the Unacademy platform and the Prep Ladder subscription, all the clinical notes, video lectures, question bank, everything you get on this amazing Iconic subscription. Muskan, good evening. How are you? And my health is perfect, dear. Do I look fine? My face is look okay. How's my haircut? I've got little new गर्मियाँ आ गई ना, मैंने बाल छोटे करा लिए. Okay, great. Hello, Angshumi Deka. Wow, what a name, beautiful name. Also, for the light-hearted students, we have this amazing pack known as Unacademy Lite, which has only test series, previous year question papers, and some beautiful grand test series. Also, at the same time, if you want to avail, like watch the previous year question bank, all you have to do is go to Unacademy app, touch on study, touch on practice, touch on subject, and solve the last 3 year question papers, because that is really very important. Also, I am launching everyday daily practice paper, guys. Whenever my name comes in your notification for the daily practice papers, solve them blindly. Okay. Also, if you're new to Unacademy, please download Unacademy. We have this beautiful poll segment. You can ask me any doubt. You never miss the classes because all the lectures are amazing. So Raj says, someone look amazing always. Thank you, bro. Thank you, Dr. Suman. I know you are a good girl, not a boy. Also, for the FMG students, we have this MCQ batch happening for 1 month, and this amazing mind-blowing educators, Dr. Nikita Nanwani, and some beautiful amazing people we have who are gonna help you out. Let's start the beautiful class of cardiology. Yes, it's important. Cardio on the rocks is what I named the show for today. Today we're going to talk about one congenital heart in depth and detail. If you are a newcomer, very cute, and if you're an old comer, very nice, because you're going to answer all the question I'm going to ask you. Okay, I hope my voice is coming. Yes, everything is coming. Dr. Ekta Tiwari says, sir, you are looking exactly same like Sumedh Radha Krishna's Shri Krishna. Is it? That's very cute. Very, very cute. Before starting any amazing segment, we always have a motivating quote. And today's motivating quote says, yesterday you said tomorrow. This is a simple quote which has a very deep meaning. Every time yesterday you said that I'll do it tomorrow. You want to study? I'll start from tomorrow. Do you want to work hard? I'll start from tomorrow. Do you want to go to gym? I'll definitely start from Monday. You think you can work hard? I'll do it, but let my friend come. We both are planning to start tomorrow. So tomorrow, what is the use of tomorrow? Yesterday you said tomorrow. Okay, so you better start from today. Everything happens today. Start everything from today. Remember that, okay? So the quote is very cute and simple, but very beautiful. It says, yesterday you said tomorrow. So today, please don't say tomorrow. Today you say, I am amazing. I am a peaceful soul. I am a happy soul. Today's topic of choice is a surprise topic. Patent ductus arteriosus. I'm going to ask you at least 100 questions on PDA. Question number one, as everyone knows about it, let's put a very good, beautiful vibration on this topic, and let's help every one of us, put amazing. Exactly. The aspiring radiologist says, sir, it's look like you have put makeup, so glowing face, energetic. Yes, bro. By the not yes in a way that I have put makeup. The yes is that by grace of God, I have positive aura, and that's why it just shines like a tomato on my face. Okay, let's start. Osama is very, very right. The patent ductus arteriosus is between very important. Now, please, let's have a very beautiful vibrations here. Patent ductus arteriosus is present between the pulmonary artery and descending aorta. If I show you this picture, this is a very beautiful picture, that this is my pulmonary artery and this is my aorta, and this is our beautiful patent ductus arteriosus. PG entrance question number 1. PDA is present between what and what? The answer is pulmonary artery and descending aorta. Very, very important. Descending aorta. Remember, okay? Right on your forehead, descending aorta. Also, this picture, if you can make out little bit, so this one kaun se wala hai? PDA. This one is the PDA, bro. This is the pulmonary artery and this is the aorta, and I can make out this one is the descending aorta. Yes, very beautifully. We're gonna finish this topic. Let's just be with me, okay? Also, whatever I have written a very less text, okay, and read that because that's important. Ductus arteriosus is just distal to the left subclavian artery. That could be a second MCQ for PG entrance, that ductus arteriosus is just distal to the right subclavian artery or the left subclavian artery. The answer is left subclavian artery. Can we appreciate this arch of aorta? Once the arch of aorta starts, the first we have the right brachiocephalic trunk, and can we appreciate over this side, once the aorta continues, we have this beautiful left brachiocephalic trunk, which basically we have a joining. That trunk is known as left brachiocephalic trunk, which gives left common carotid artery and left subclavian artery. Can we therefore appreciate this point, that this is my left subclavian artery and this is my ductus arteriosus? So is this line fair enough, that the ductus arteriosus is just distal to the left subclavian artery? Photographic memory, remember that, okay? Please allow your brains, tell your brains that you have very amazing photographic memory, and look at the picture, click it in your eyebrows and your eyes and finish it off. So distal to left subclavian artery, ductus arteriosus is present, number 1. Number 2, and ductus enters the pulmonary artery at its bifurcation. So beautiful point. It could be a PGI question, true or false, that ductus arteriosus usually enters at the bifurcation, yes or no? The answer is yes. This is the pulmonary artery. It has a beautiful this bifurcation and this bifurcation. So at the bifurcation over here, we have the ductus arteriosus. Has everyone understood this much? मोती की तरह मैं points बता रहा हूँ with a very crystal clear. I'm trying to make a attention here and making you tell some important points. Perfect. Okay, let's move further. We have 100 students who have come today. Great. Also, at the same time, let's talk about it. So yes, what happens to the M1? Can you please tell me what happens to the M1? If you are a newcomer, then you know we have something known as S1 and S2. The first hard sound is because of the closure of the S1. S1 contains the tricuspid wall and the mitral wall. Nothing but you can say T1 and M1. So the first hard sound is basically because of the closure of the, very importantly, tricuspid wall and the mitral wall. The second hard sound, basically it because of the closure of the A2 and P2. This is our A2, this is our P2, P2. ठीक है, समझ में आ गई इतनी कहानी? Can you please tell me now that if I am suffering from patent ductus arteriosus, what will happen to my M1? ये वाले को क्या होगा? Will M1 will be loud or will M1 will be soft? It's a healthy discussion on a very positive note. So just talk to me, just discuss with me, right? If you have any doubt, ask me. As everyone says the right answer, I assume that you know that in a case of patent ductus arteriosus, is it a right to left shunt or a left to right shunt? The best answer is it is a left to right shunt. Very important. Why, sir? Because the left side of the heart has a higher pressure and a higher musculature. So normally the shunts of the what we call atrial septal defect, ventricle septal defect, and patent ductus arteriosus, they all are left to right shunt. Once it is left to right shunt, more and more blood enter into the pulmonary artery, and pulmonary artery ke baad where does the blood goes? It goes to the lungs for the purification, and from the purified blood, with the help of what? Pulmonary artery or pulmonary veins? With the help of pulmonary veins, it enters the left atrium. So can we therefore appreciate that more and more blood entering in the left side of my heart? So M1 will be undoubtedly one will be loud. Yes, yeah, Arjun, yes, bro. In a case of Epstein anomaly, the shunt will be right to left. There is no doubt about it, है ना? Because in Epstein anomaly, there was a problem with the tricuspid valve. So all the blood tried to shunt off from the right side to the left side. Okay, so that's what. So yeah, and also Osama has mentioned this point very beautifully, that if I am saying that the patent ductus arteriosus is a left to right shunt, if I am saying that the more normally from the superior vena cava, the blood enters to the right atrium, then to the right ventricle, then to the pulmonary artery, and now from the left side also so much of blood entering to the again to the pulmonary artery. So it means I can say more and more blood entering to the pulmonary artery. If the more and more blood enters to the pulmonary artery, it got stuck. Why it got stuck? Okay, it will come. Sometimes it takes time, so pray to God that the internet connection goes fine. Is it getting stuck? Okay, so okay, 1 second. Yes, I also can see it is getting stuck. Let's see. Let's wait for 5 seconds. Sometime there gets an internet glitch. So yeah, now it's okay again. Okay, don't mind, okay guys, because internet connection, my bhabhi must be watching some amazing Netflix series, that's why this thing is getting stuck. So don't mind, just wait for 5-10 seconds, have patience, and it will come again. My question over here was, yes, should I do 5G? 1 second, I'll just do 5G. Okay, I have a 5G connection also. Let me just try with the 5G. Maybe that thing comes. Okay, it seems 5 seconds glitch here and there will happen. I'm really sorry about it, but just try to cooperate. I hope things will be fine, because this is not in my hand. Even though I get the most expensive internet connection, someone will jump here and there, right? This is India. Okay, perfect. So yes, I hope everyone appreciates this point, that patent ductus arteriosus is a plethoric lung field condition. Plethoric means increase pulmonary blood flow. Next important point I would like to ask you here. So most importantly, yes, what happens to the shunt murmur? Can anyone tell me one small guess? What happens to the shunt murmur in a case of patent ductus arteriosus? Any random guesses? What kind of murmur do we appreciate in a case of PDA? Yes, very true, Dr. Suman, will have a continuous machinery murmur. Can I write this point that patent ductus arteriosus may you'll get a continuous machinery murmur? You get a continuous machinery murmur. That's true. And can you please tell? It's a homework for you. Okay, it's a homework is Kerry-Coombs murmur. Have you heard of Kerry-Coombs murmur? Where do you see Kerry-Coombs murmur? That's a homework for you. In the next class, tell me where do you see Kerry-Coombs murmur. I hope my voice is coming to everyone, and if there is a small internet glitch, please try to avoid that. Okay, perfect. Next important point, my question is, what will happen to S2 in a case of large PDA? Now this is something a crazy question. Can you please tell me? Number one, the hint is it's a large patent ductus arteriosus. Okay, what will happen to the S2 sound? Means S2 comprises of A2 and P2. second heart sound is because of the closure of the aortic and the pulmonary walls. What will happen to the S2 sound in a case of large PDA? The word is large, not a small PDA, not a normal PDA, large PDA. Anyone? Yes. We must appreciate that in a case of large PDA, very important point, there will be a paradoxical splitting of S2. Listen very carefully. I'm going to tell you why there will be a paradoxical matlab ulta, paradoxical split of S2 in a large PDA. Why, sir? Why will you see paradoxical split in a large PDA? Yes, point number one, you know that, right? PDA, it is a left to right shunt. Just go by the text, okay? It's beautifully I have incorporated. As you, point number one, as you all know that patent ductus arteriosus is a left to right shunt. In a case of large PDA, what happens? In the large PDA, there will be left to right shunt followed by pulmonary obstruction, and then the shunt will become right to left. Are you understanding? I'm telling something like of a Eisen-Mingerization or a reversal of shunt. What happens in a case of large PDA? Point number one, there will be left to right shunt. Then slowly when there is increased pulmonary blood flow, what happens? Slowly the pulmonary artery starts going to close, leads to pulmonary obstruction, and this pulmonary obstruction, naturally the shunt of the blood which was left to right becomes right to left. Has everyone understood this much? I hope I'm making a point clear. This is, I'm talking about the large PDA, okay, large PDA. Number one, yes, after what happens, can I therefore say that the shunt which was left to right, there was pulmonary obstruction or pulmonary artery kind of a hypertension, the shunt which was left to right becomes right to left. उसके बाद क्या होता है? After that, can I say more and more blood now is entering the, and more and more blood in the, see, basically what happens now, what will happen? A2 now will close late than the P2. Normally what happens? Can you please tell me? See, normally A2 closes first. If you talk about A2 and P2, normally A2 closes first, then the P2, because there is so much of blood from the superior and inferior vena cava has to enter the right side of the heart. So A2 closes first, then the P2. But in a case of large PDA, P2 will close first, then the A2, right? And now this is known as paradoxical splitting. Okay, I'll repeat again. Remember, this thing is important. Okay, in a case of large PDA, number one, it was left to right shunt. Number two, there became a pulmonary obstruction leading to shunt of right to left. Once there is right to left, then normally what happens? Normally aortic component closes first, then the P2. But now because of the pulmonary obstruction, of course, the P2 closes first, then the A2. Now this is known as paradoxical split. This is known as paradoxical split. Osama, bro, did you understand this paradoxical split? So this word is really important for clearing exams, that what kind of shunt thing you see in a case of S2. The answer is paradoxical split. Okay, remember that. Okay, and remember these three important words. In atrial septal, see, ASD, VSD and PDA. Okay, ASD, VSD and PDA, they will ask you the S2 findings. Okay, in atrial septal defect, there is wide fixed split of S2. In ventricle septal defect, there is wide variable split of the S2, and in PDA, there will be paradoxical split of the S2. These three words are important. Sir, I'm not able to remember. How will I remember this? See, V for VSD, V for variable split, and P for PDA, P for paradoxical split. It's as simple as that. Has everyone understood this much? This is important. It's like a maths. You have to understand. So what happens to the S2 component in ASD? Wide fixed split. VSD, wide variable split, and PDA, paradoxical split. Now the next question is, yeah, this is a very good question. Can you please tell me, Dr. Osama, Ekta, Arpita, Suman and amazing people, What are the complications of large PDA? What happens? What can happen in a case of large PDA? Can you please tell me what do you think, Dr. Suman? Yes, in a case of large PDA, the complication. Now, this is such an important. Now we are entering the next lot of questions. Okay, a patient of large PDA means the blood is going from the left side to the right side, right? It's a left to right shunt. In general, it is a left to right shunt, no? So in the case of large PDA, the patient can have renal problem, the patient can have necrotizing enterocolitis, the patient can have even intraventricular hemorrhage, bronchopulmonary dysplasia, or myocardial ischemia. Now the huge big question is why? Can anyone give one small guess? Yes, Osama is right. When normally PDA, which is I'm talking about I'm talking about the initial stages of PDA. Okay, normally PDA is a left to right shunt. Yes or no? Everyone knows about it. Means more and more blood entering into the pulmonary artery. Means increased pulmonary blood flow. Can these babies can have more URTI and LRTI? The big answer is yes. The baby definitely can have more URTI and LRTI, because when there is increased pulmonary blood flow too much, then definitely the baby can have more lungs issues. That is one slot of story which is very genuinely right. But now my question is over here. Okay, this is a very important slide. The baby of patent ductus arteriosus can have necrotizing enterocolitis, but they can have stomach problem, they can have kidney problem, they can have GIT problem, they can have brain problem, they can have lungs problem. Are you understanding? Too much of problem this is, bro. This is too much. Why? Can anyone please tell me why such a huge issues the baby will have, Osama? So now the biggest answer for this question is because of ductal steel phenomenon. There is a very beautiful thing known as ductal steel phenomenon. What is the meaning of that? It's a very beautiful explanation. Ductal steel phenomenon is nothing but, you know that, right? That in a case of patent ductus arteriosus, which is a right to left shunt, basically the blood is going from the left to right. So the blood which normally should go to the aorta and supply to the whole body, will that blood flow will be compromised? Yes or no? What do you think? Naturally, yes, no, because ductal steel phenomenon is a self-explanatory word. The patent ductus arteriosus is a left to right shunt. It is stealing all the happy, positive oxygenated blood. It is stealing from the aorta. So then the blood from the aorta to the whole body, will it go properly or it will not go? Will it be compromised? Yes or no? It will be definitely compromised. Can I therefore appreciate this line that once from my aorta the blood flow will be compromised to the whole body? So means compromised blood going into the GIT leading to necrotizing enterocolitis, less blood going into my brain leading to IVH, less blood going into my kidney leading to acute kidney injury. So all the answers for this question was ductal steel phenomenon. Has everyone understood this much? Yes or yes? Great. And also at the same time, one more thing we need to understand. Can we please read this line? Ductal steel, read every single word, okay? It's like beautiful. Ductal steel phenomenon. It is a phenomenon where a left to right shunt causes significant retrograde flow of the blood from the thorax and abdominal aorta to the pulmonary circulation. Now this is an extra point, okay? Number one was that from the aorta, the blood which was supposed to go to the whole body, anyhow it is stolen by the ductus arteriosus, and whatever the blood which has gone to the thorax and little to the abdominal aorta, that also retrograde. Can you appreciate this word retrograde? Retrograde, पीछे से वहां से भी खून चूस रहे हैं लोग, समझ में आ रही है? So there also the blood has been stolen by the ductus arteriosus. So means means the retrograde, the backward, like it's like a sucking thing, okay, like a pump which is sucking away the blood which is coming from the aorta, that also going to the PDA, and the blood which is going to the thoracic and abdominal little down, that also is coming back to the PDA. So this is a very important, very beautiful point. It's a 5 marks question. What is ductal steel phenomenon in a case of patent ductus arteriosus? Can I say that it will lead to systemic hypoperfusion? Systemic में hypoperfusion होगा naturally. It'll lead to all renal hypoperfusion, mesenteric hypoperfusion, coronary hypoperfusion, myocardial hypoperfusion, and all the favorites positions. I'm saying all the favorites hypoperfusion, whichever you can think of, it will cause. Also at the now this is the next lot of question. This cardio is like maths, okay. I've taken notes, make notes from the park cardiology, so it's like very beautifully I have incorporated. The next slot of thoughtful questions are, due to this ductal steel phenomenon, ductus arteriosus is stealing the blood, no? So can you answer this question? So can they compensate by increasing the stroke volume? My body, everything has been stolen by the ductus arteriosus, but still I have to supply the blood to my renal, my kidney, my heart, and my brains, right? So can a newborn baby compensate this issue by increasing in the stroke volume? Yes or no? So yes, Osama is very, very right. Remember, usually, you know, what is stroke volume in general? Stroke volume is the volume of the blood pumped out of the left ventricle, this one. So volume of the blood pumped by the left ventricle of the heart during each systolic contraction, right? This is known as stroke volume. Volume of the blood pumped by the left ventricle, basically, of the heart during each systole. Systole matlab contraction, right? Okay, mixed answers we have, but the best answer to this one is, my question was, due to ductal steel phenomenon, can a newborn body compensate by increasing the stroke volume? The answer is no. A newborn baby can't do all that. Why? Because the increased left ventricle volume load is poorly tolerated by the preterm, because they have a poorly compliant left ventricle. Please allow this information to your brains. We are talking about preterms, right? Is patent ductus arteriosus common in preterms or terms? It is common in preterms, right? Premature babies. Premature baby, remember the mnemonic, not the mnemonic, the theory, everything is weak. Everything is weak. Everything is weak. Can preterm baby land up into hypoglycemia? Yes. Can preterm baby land up into apnea of prematurity? Yes. Can preterm baby land up into hypothermia? Yes. For everything, the answer is yes. Can preterm baby tolerate such like a compensatory increase in the stroke volume? The answer is no. Okay, Baba, preterm is very weak. He can't do all that. Okay, so that's what the answer is. Remember, now please allow your brains this information. Okay, that can a preterm baby compensate this issue, this ductal steel phenomenon, by increasing the stroke volume? The answer is no. They can't do this overload issue. Okay, now the best answer, double star mark super specialty question is, so hence they have, as I know that hence they have limited capacity to increase the stroke volume, but they can compensate by increasing the heart rate. Now this is the take home message, that stroke volume doesn't increase in a case of PDA because of the compensatory ductal steel phenomenon. There is only and only increase in the heart rate. Will you remember this for me, please? Remember, there is only and only increase in the heart rate. The take home message is, definitely there is a solution for this ductal steel phenomenon. Baby will die, okay? If there's ductal steel phenomenon, the baby will die of NEC and 1,000 other problems. But the compensation, how it is happening? By increasing the stroke volume? No, not by increasing the stroke volume. Only they are compensating by increasing the heart rate. And that is why the logical point is, that is why you see a hyperdynamic precordium. So much of heart rate, so much tachycardia, so much of heart rate is there That is why a very beautiful point which you should not cram, that a baby of apna patent ductus arteriosus, can it have or will it have hyperdynamic precordium? The answer is yes, they will have hyperdynamic precordium. And so much of heart rate, issue this baby have. Can I say that these baby will have a क्या बोलते हैं उसको, bounding peripheral pulses? Can I write this line? Can a preterm baby of PDA have bounding peripheral pulses? भाई heart rate बढ़ रहा है, सब कुछ बढ़ा दो. Okay, so the answer is yes, the baby can have a bounding peripheral pulses. Can I write the PDA baby will have a palpable, easily palpable dorsalis pedis artery? Can I write this question? This is a very important star mark PG question. A preterm baby who was found to have a bounding peripheral pulses, hyperdynamic precordium, easily palpable dorsalis pedis artery. What is the best diagnosis? The answer is patent ductus arteriosus. Has everyone understood as much? Yes or no? समझ में आया या नहीं आया? नहीं आया, I would recommend please take 1 spoon of Chyawanprash with half spoon of honey with 10 almonds per day. Still you're having it and still it didn't clear, then go to temple, pray to God for your long life. Still not clear, then do 16 सोमवार के व्रत रखो, याद रहेगा. Let's move further. Yes, so these are the beautiful points, guys. So now, will you remember this forever? Not just for the PG exam, just normal as a human being. Will you remember that the baby of PTA will have a hyperdynamic precordium, bounding peripheral pulses, easily palpable dorsalis pedis artery, and a wide pulse pressure? Wide pulse pressure, exactly. Yeah, क्या है? क्या दीवार में मारे बना? Yes, that's true. I agree with you. That's true. So, and also, can I write the baby will have hyperactive precordium? Hyperactive precordium bole, hyperdynamic circulation bole, bro. Everything makes sense. Okay. Nothing but what is hyperactive precordium? Visible pulsations in more than 2 rib spaces. 1 rib space, 2nd rib space. Visible pulsations. Okay, visible pulsations. Okay, remember that. ठीक है, it's बड़ी मोती की तरह मैंने ये टॉपिक बताया है. प्लीज कोशिश करें इसको याद करने की. ठीक है. Also, yeah, this part is over. Will the patient have persistent tachycardia? That's how we diagnose. Like one of my favorite ma'am, Dr. Nidhi, she is DM neonatology from MAMC. So she is there in our hospital, in our NICU, and whenever a preterm baby has tachycardia, so she always tell me कि Anand, please rule out PTA. Anand, please rule out PTA. Bounding है क्या? Pulses bounding लग रही है क्या? अच्छा ठीक है, काम करो, PCM start कर दो इस बच्चे में 6 hourly. PCM, paracetamol. For closing the PDA, we have options, right? Ibuprofen or indomethacin, as every one of you must be knowing already. But in our hospital, paracetamol also can be given. So हम PCM देते हैं हमारे hospital में. Yes, exactly. Large PDA में एकता has a very beautiful question. Large PDA में ductal still phenomenon होगा, फिर धीरे धीरे प्रॉब्लम होनी शुरू हो जाती हैं. पहले PDA होगा, लार्ज PDA होगा, फिर ductal still phenomenon होगा, फिर धीरे धीरे होते होते पल्मोनरी आर्टरी बंद होने लग जाएगी, फिर रिवर्सल ऑफ शंट हो जाएगा, और फिर पैराडॉक्सिकल स्प्लिटिंग हो जाएगी. तो ऐसे करके पता होना चाहिए. ठीक है. ओके, नेक्स्ट PG एंट्रेंस क्वेश्चन नंबर 17. Which day of life we should expect the symptoms in a case of PDA? Very beautiful question. These all drama of hyperdynamic precordium, this, that, bounding pulses, easily palpable dorsalis pedis artery. When are you expecting gonna have it? Preterm baby आया, अभी हाथों हाथ मिल जाएगा. कब मिलेगा? डॉक्टर ओसामा, अर्पिता, Ekta Tiwari, Mansi. Yes, the best answer for this question is day 3 or 4 of life. Roughly around 3 to 4 days. It takes time for the whole issue to happen. So day 3 to day 4 of life, you will see what you called expect the symptoms. And I have a very good question here. If this was the question options and option was NEC, what is the ideal time? One preterm baby I have admitted, that preterm baby is on was on bottle feeding, the mother was expired, so naturally the one who's on bottle feeding a preterm baby has a very high chance of developing stomach issues known as necrotizing enterocolitis. The question is, which day of life we should expect the symptoms in a case of NEC? Now tell the answer. What do you think, Dr. Suman, Arpita, Ekta, Arjun, Aryan? What do you think, bro? Hanji? Very good. And I recommend every one of you to have water in glass bottles. It's nice. Please avoid plastics. It's not good for health. Okay. And if you're giving exams, make sure you take some vitamin B complex tablets also. It has antioxidant properties. हाँ ओके चलो आई एग्री ठीक है अच्छा आंसर दिया ओसामा हैज टोल्ड द राइट आंसर यूजुअली necrotizing enterocolitis also takes time. Everything takes time, bro. These all are congenital problems, but they all take time. Our AIMS protocol says it takes around day 10. It takes around 10th day, 10, 12 days, I would say, second week onwards. It usually takes around day 10 onwards for a baby to develop the symptoms of necrotizing enterocolitis. But remember, I'm telling you now also, and I told you 1,000 times, examiner will not ask you a ditto answer. Like बिल्कुल किताब का रटा हुआ आंसर examiner नहीं पूछेगा. Examiner will not ask you exact copy paste answer of the book. He will ask you choose the closest best option. Even though NEC is not seen in the first week of life, but if I give you this option, then of course day 4 and day 5 will be the best option. It is the closest best option, remember my dear friends. And normally वैसे day 10 पे मिलता है, मतलब day 10 onwards मिलता है करके, ठीक है, समझ में आ गया, perfect. And also one question of CHPS, congenital hypertrophic pyloric stenosis, which is the most, again can you tell me which is the most commonest age presentation? The name is congenital by birth. So can a newborn baby present to you with symptoms of CHPS? Pyloric stenosis, remember, vomiting, projectile, profusive, postprandial, non-bilious vomiting followed by voracious appetite. कब मिलता है? Yes, done. Perfect. So what do you think, Dr. Osama? What do you want to answer it? Age कब होगा? Newborn baby भी मिलता है? My question is age. Can you see CHPS in 2 days baby, 5 days baby, okay, 10 days baby? Do you see that? Okay. Yeah, the best answer for that question was actually 4 to 6 weeks. It takes the most common age presentation of a CHPS is roughly around 4 to 6 means 4 to 6 weeks, the presentation for the symptoms. That is a very important PG question. The question will be, a 1-month-old baby come to you with vomiting, projectile, non-bilious and this and that, okay? And you'll be like, 1-month-old baby CHPS is congenital. No, why 1 month? But yes, 3 to 6 weeks, some book says, or 4 to 6 weeks is the most common age presentation. So can we therefore appreciate that NEC is congenital problem, but comes to us at day 10 of life? This one, CHPS is a congenital problem, comes to us at 4 to 6 weeks of life, and even patent ductus arteriosus also is a preterm congenital problem, but the proper clinical variation symptom will come by day 3 or day 4 of life. Okay, beautiful. Is everyone enjoying the class? समझ में आ रहा है या दिमाग के ऊपर से जा रहा है? Anyone? It's a light topic. I have tried my best to keep it in a very light way. Osama bro, समझ में आ गया? Next question. What is the gold standard? What is the gold standard investigation of choice in a case of PDA? Who will tell me? मुझे PDA लग रहा है सर, मशीनरी मरमर लग रहा है मेरे को. What is the इस one? Yes, so Dr. Suman, so beautiful, 10th in NEC. हाँ, very nice, Dr. Suman, very beautiful answer. I wish I could pin your answer, but I only have an option to block you or report you, which I don't want to do. Hanji. Yes, the best answer is nothing but echo. Echo is the gold standard investigation of choice in a case of apna PDA. If I say transcranial ultrasound, can we link and study? Transcranial ultrasound is the investigation of choice in which problem? Can anyone please mention at least two? At least two. We have done in the previous classes. I told you these 3 conditions, you will get a transcranial ultrasound as a investigation of choice. Hanji, Arjun, Priyanka, yes, Osama is always right. Hydrocephalus, very important. The investigation of choice in hydrocephalus is transcranial ultrasound. And what else? वेरी गुड, वेरी इंप्रेसिव। किसने बताया ये? ओसामा ने ही बताया, बताओ, हद है, बहुत अच्छी बात है। आईवीएच, यस, द इन्वेस्टिगेशन ऑफ चॉइस इन आईवीएच, इंट्रा वेंट्रिकुलर हेमरेज, इज ट्रांसक्रेनियल अल्ट्रासाउंड। एंड व्हाट एल्स, what else? You sure in HIE you do transcranial ultrasound? I doubt. Anyone? HIE, okay. If the baby has not cried immediately after birth, you do MRI, okay. CT or MRI. Imaging would be better, okay. The next one is neonatal seizures. Neonatal seizures. In a neonatal seizure, also the investigation of choice will be transcranial ultrasound. Very, very, very important point. 3 questions, 1 answer. What is the investigation of choice in neonatal seizure? Hydrocephalus and intraventricular hemorrhage. The answer, ब्यूटीफुल आंसर इज ट्रांसक्रेनियल अल्ट्रासाउंड, ठीक है, या ओके, या सो डॉक्टर सुमन कह रहे हैं सर मैंने बताया था आईवीएच गलती से रिमूव हो गया। ओके डियर, बट दैट्स ब्यूटीफुल आंसर इफ यू हैव गिवन। Okay, next one. So this part is over, everything is over. Yeah, could you please tell me the ECG findings in a case of patent ductus arteriosus? कौन सा axis deviation मिलेगा? Will you see a right axis deviation or you will see a left axis deviation? What would you like to answer? Dr. Osama, Dr. Ekta? बताओ। इन द नाइट 12 o'clock 100 स्टूडेंट्स हैव कम। काम नहीं है, वेले हो इतनी रात को, सो जाओ, वॉच द मूवी। व्हाई यू हैव कम, व्हाई यू हैव कम हियर, गो वॉच मूवी। ओके, यस, सो द ईसीजी, हाँ, ओके ओसामा ब्रो, ऑलवेज रिमेंबर, देखो, could you please tell me that in the case of PDA, the picture is in front of you bro, could you please tell me in a case of PDA, do you see right ventricular hypertrophy or left ventricular hypertrophy? Or can you tell me right side of the heart is more enlarged or the left side of the heart is more enlarged? The answer is left side, no, because so much of blood entering into pulmonary artery, then going to lungs, and then again to the left atrium and left ventricle. So left side of the heart is more kind of a, you know, bigger, right, in a case of patent ductus arteriosus. So yes, there'll be left atrial enlargement, there'll be left ventricle enlargement. So whichever heart side is enlarged, that only side you'll say left axis deviation. ECG में ना ऐसे याद रखना, if I say left axis deviation means there is left atrium or left side of the heart's hypertrophy. So इसलिए याद रखिएगा ये important problem, exactly. So you'll see left axis deviation in a case of PGA. याद रहेगा ये ओसामा, अब याद रहेगा ब्रो, राइट एक्सिस नहीं लेफ्ट एक्सिस, क्योंकि लेफ्ट साइड ऑफ द हार्ट ज्यादा बढ़ रहा है, ज्यादा प्रेशर हो रहा है, तो लेफ्ट एक्सिस, ईसीजी की लीड्स में लेफ्ट एक्सिस डेविएशन आएगा। नेक्स्ट वीक आई एम प्लानिंग टू टेक अ क्लास ऑन ईसीजी and 1 class on ABG. If you want to have a class, let me know in the comment section if you want to have a class. Mansi says we want to be great doctor like you, sir. You will be more amazing doctor than me. Okay, that part is over. Chest x-ray, yeah, chest x-ray number 1, will you chest x-ray mein will you see cardiomegaly in a case of PDA? Yes or no? Naturally baba, there's so much of left heart issue, definitely cardiomegaly. And will you see plethoric lung fields? Definitely plethoric lung fields. Next important point is, now we coming to the end of the class. Can we have, yeah, exactly, Suman says ECG ABG amazing topic, definitely. ठीक है ओसामा, मुझे याद दिलाना मैसेज में, मैं उसके नोट्स बनाना शुरू कर देता हूँ। We have so many students today midnight. Okay, medical management. Could you please tell me which medicine do you want to give me in a case of PTA? The option number 1, I think everyone knows about it, right? We have 3 options: indomethacin, ibuprofen, and paracetamol. These, at least the doses are important. What is the dose of paracetamol in the case of patent ductus arteriosus closing? The answer is roughly around 15 mg. Normally बुखार में भी इतना ही देते हैं. Remember, if someone is having fever, then if you want to give, you know, PCM, 15 mg per kg per dose is the dose in a basic fever also. Tell me one thing, this PCM you want to give oral or you want to give IV or IM? What will you prefer, guys? This baby is a preterm whose patent ductus arteriosus is open. You have 3 options. सिरप पिलाएं बच्चे को, IV दें या IM दें. Yes, the best answer is usually IV. बच्चा जब sick होता है ना, when the baby is sick, this baby looks sick, right? His PDA is open and bounding peripheral pulses and all that. Then I think IV sounds better. We in our NICU, in good corporates ICUs like AIMS and government plus private any ICUs, IM injections to newborns we don't give. I'm saying IM antibiotics we don't give. All Taxim, Amica, Cefotaxime, whatever Piptas, Meropenem, Imipenem, all the antibiotics. Usually IV sounds really a nice route, IV route. No IM injection we no don't give only. Don't give, okay. Only one IM injection we give. Which one? Injection vitamin K. Am I right? Do we give vitamin K to a newborn? You know that, right? We give that only one, that thigh pain injection on the anterolateral aspect of thigh at the vastus lateralis muscle. We definitely give injection vitamin K because breast milk is deficient in vitamin K and vitamin D and vitamin B12, right? Perfect. Next question. The dose of PCM was 15 mg per kg per dose. What is the dose of the ibuprofen? So ibuprofen is 10 mg per kg. So please remember 10, 5, 5. Can you please remember this? Please remember 15 and 10. Okay, link and study. Smart study. Okay, don't do hard work. Smart. Keep it light. Please, your brains, keep it very light. It's a very light topic. Keep it very comfortable. आराम से बातें करते करते खत्म करो. What is the dose of PCM? 15 mg per kg per dose. Ibuprofen 10 mg per kg per dose, but that's not sufficient. So 10, 5, 5. 10 mg per kg today, 5 mg per kg tomorrow, and next day again 5 mg per kg per day. 24 hours apart. Are you understanding? On Monday you give me 10 mg per kg per dose. On Tuesday 5 mg per kg per dose. On Wednesday 5 mg per kg per dose. That's it. Okay, perfect. Yes. And indomethacin, yeah, so that's what this is better. So now we are coming to the end of this topic. What is the contraindication of giving indomethacin? Can you please make me remind what are the contraindication of giving indomethacin? Any random guesses? Contraindication of giving indomethacin, or I would say exactly contraindication of giving these drugs, even ibuprofen also. If I talk about what is the contraindication, in which case even though the PDA is open, I cannot give to this child. The best answer is if I'm suffering from thrombocytopenia. This could be a very important. So PG entrance question number 20 for FMGs, INI-CET and NEET PG. If I'm suffering from thrombocytopenia, don't give me ibuprofen. If I'm suffering from clinical bleeding, I'm having bloody stools, I'm very sick, I am on inotropes, I'm having shock. Are you understanding? So don't give. Number one, thrombocytopenia, don't give anything to close the PDA. Clinically bleeding, don't give. Acute kidney injury, serum creat more than 1.6, so don't give. Okay, and if oliguric cutoff is there, that is less than 1 ml per kg per hour, so all those conditions you do not give. They are the contraindications. Very important slide. Contraindication of giving indomethacin or ibuprofen. Very good. Next important point, yeah, even someone said in the evening class also, I had to someone told me patient of IVH and NAC, don't give any drugs to close the PDA. Perfect. Next. Yeah, okay. This is so nice. So again, we have a quick motivating quote which says, I know happiness is temporary. I know happiness is temporary. So is the sadness. So if you are sad in life, remember it's temporary. It will go. Don't take heavy decisions when you are sad, because I know happiness is also temporary, but so is the sadness, right? Now the PG entrance question number 21, many students ask me this doubt, sir, agar option aa gaya indomethacin or ibuprofen dono, so which is preferred? Can you please answer in the comment section? Osama, Natasha, Ekta, Suman and Mansi and Panchal and so many people. हाँ जी, कौन सा ऑप्शन क्लिक करेंगे आप? Is ibuprofen better or indomethacin better? So this was the FMG question. Usually syrup ibuprofen is preferred. Okay, is preferred. Ibuprofen. Why? Okay, now listen very carefully. If I talk about indomethacin and ibuprofen is preferred without fail, because it's a syrup ibuprofen and it's easy to give and all that. But if the question comes between ibuprofen and PCM, right? In our hospital, वैसे we give PCM, but I'm not saying that's a drug of choice. Which is preferred? Who will tell me? between ibuprofen and PCM अगर क्लिक करना हो ऑप्शन तो किसको क्लिक करेंगे आप? Which one will you click? Yes, very good. The best answer will be usually oral PCM is preferred because it lacks major side effects of NSAIDs. See, in the end, ibuprofen is an NSAID, no, non-steroidal anti-inflammatory drug. So, book says that oral PCM is preferred, but is PCM the drug of choice? Now, this is the exam question. PG entrance question number 22. Is PCM the drug of choice in a case of closing PDA? The best answer is no. No, because there were experiments in the neonatal mice. Then they also had some autism issues. You know, during the prenatal exposure, there was development of autism in the children. So no, PCM is not the drug of choice. So overall, you see basically that overall the best answer is oral route of ibuprofen. Ibuprofen is better. So the take home message is, which is the drug of choice in closing of patent ductus arteriosus, the answer would be happily ibuprofen will be a very comfortable answer. Okay, next one. This part is over. Yes, and last but not the least, surgery, right? Surgery is option. Acha, there was a very nice question here. Preterm baby, right? If the baby is preterm, of course you will give me something to close the PDA and all that. Is what do you called this ibuprofen and all those things basically, are they important in closing the PDA in a term baby? Yes or no? This was the PG question, that ibuprofen or indomethacin or PCM, are they helpful in both preterms and terms, or only in a preterm baby having PDA this closing issue will be helpful? Who will tell me? Yes, very good, very good, very good. The best answer is ibuprofen, indomethacin, paracetamol, anything you say, they are not effective in a term baby. Remember, in a term baby, who is having PDA, you have to have a surgical treatment. Please remember, guys, this is important. Can you close the PDA of a preterm by medications? Yes. Preterm baby PDA can be closed by ibuprofen, indomethacin, paracetamol. But these all drugs will have no role in a term baby. Term baby having PDA, surgery only would be a better answer. And of course, you will do a surgical ligation or a coil embolization. You do. Prefer you close before the first birthday. First birthday is the answer. Okay, first birthday is better you close usually before the first birthday. Can you please tell me the physiological closure and the anatomical closure of PDA? In how many times happens does it close? Anyone? Dr. Ekta, Suman, Arjun, Arya, Natasha. PDA बंद होता है ना, normally बंद होता है. So what is the what duration is the, in how many hours of life the PDA has a physiological closure and the anatomical closure? Osama answer बताओ मुझे इस चीज का. What do you think? So yes, the best answer is 10 to 15 hours and 10 to 21 days. Very important question. It already has come in the NEET PG and FMG paper. Pancholi, Hanji. The physiological closure happens in 10 to 15 hours, but the anatomical closure happens in 10 to 21 days. Physiological closure 10 to 15 hours. Yes, yeah, I know, dear, it is hard to learn. That's why I'm trying my best to make you learn. Physiological closure in 10 to 15 hours, anatomical closure 10 to 21 days. Perfect. Yes. What are the complications of surgery? Can anyone put a mention here? PDA था, surgery से बंद करवाया, कुछ हो सकता है usually baby को? Yes, the baby can have pneumothorax, the baby can have chylothorax, the baby can have infection, so obviously the baby can have even vocal cord palsy. Some book have told that the infection wala nidus has gone to the vocal area also and cause infection. So vocal cord palsy also. So pneumothorax, chylothorax infection and vocal cord palsy are very, very important. Right? This part is over. Yeah. And PDA, last question for this slide. Patent PDA we are studying, no, patent ductus arteriosus. Do we have PDA connection in some torch infection? In congenital rubella syndrome, do we have some connection of the PDA? Yes or no? Dr. Suman, Osama? Yes, very good, very good. The congenital triad of congenital rubella syndrome is nothing but very important. Cafe coffee day. We have done that, right? The most common congenital heart. C for congenital heart. The most common congenital heart in congenital rubella is patent ductus arteriosus, and then we have cataract, and then we have deafness. And the most common manifestation among cafe coffee day is deafness is the most common manifestation. We have done that. Last question for this slide, then this class is over. NEET 2019 question on PDA. Where to look for a pre-ductal oxygen saturation in PDA in a 3-minute born baby? What do you think, guys? Do you want to answer this question, or do you want to skip? Okay, anyone? Yes. Where to look for preductal? Preductal, the word is beautiful. Okay, preductal, ductus arteriosus के connection से पहले preductal oxygen saturation in a what you call 3 minutes born infant. So someone says right upper limb. Okay, so very beautifully, yes, the best answer is actually right upper limb only. Now tell me why. Okay, I only tell you. Hanji, yes, Arjun, sensory neural hearing loss, deafness was there in congenital rubella. You were right. Now, please remember, in a case of patent ductus arteriosus, this is the lungs. Okay, the oxygenated blood from the lungs with the help of pulmonary veins enter the left atrium. This is the happy blood, positive blood, oxygenated blood. Then the blood enters in the left ventricle, and then it enters into the aorta. The question was pre-ductal, मतलब ductal connection से पहले. Before this connection of the ductal, can we please see this picture that this oxygenated blood enters the brachiocephalic artery. Aorta is there. No, I showed you the picture also. Remember, I showed you the picture in the beginning that aorta is there. Before touching the PDA, the aorta gives a branch to the brachiocephalic artery and then to the right subclavian artery. This right subclavian artery, it supplies my right upper limb. So this will be a preductal. Because, right, are you understanding? This will be the exact oxygen saturation, I would say. In our see, this is like theory question, we clinically also follow in our hospital also. If the lower limb saturation is like going down and this and that, we always say preductal check karo, check preductal check karo. वो क्या होता है? Preductal means we will put the SpO2 probe in the right upper limb, because right upper limb will give us the true saturation, will give us the right saturation, because there is no mixing. Once the blood goes little over here, then yes, there is mixing. Yes, there is mixing of blood and this and that, all that drama. Okay, that's why the best answer is right upper limb. That's it. This part is over. Yes, that finishes today's class. Thank you so much for the participation. Is the class clear to you? Yes or yes. Put it, you can give a like to this video if you have understood 1% of it. I have tried my best to make it as comfortable, as innovative, and as expressful as possible. And before leaving, we always have a motivating quote. The quote says, priorities varies according to your wishes. Priorities varies according to your wishes. If you wish to get a PG seat, your priority will automatically vary. You will start studying, you'll become more nice and all that. So that's what. So make sure your wish is amazing, because your priorities automatically will go towards your wishes. So if you are truthful to your wishes, automatically you'll create a timetable, automatically you'll create a beautiful priority of your life. So priorities actually varies according to the wishes. And remember, very importantly, venture outside your comfort zone. Venture outside your comfort zone. What is easy? Doing nothing. What is easy? Doing nothing. What is easy? Watching TV. What is easy? Shouting at others. What is easy? Not going to gym, relaxing at home, doing nothing. But remember, venture outside your comfort zone. The rewards are worth it. The rewards are worth it. So just tell yourself every day, you know, that if you think you can't do it or it's outside your comfort zone, it will be painful, it will be irritating, it will be very irritating, but in the end it will make sense. The only moral of the story is, in the end it will make you a better person, it will enhance your knowledge, it will enhance the vision of your life, and somewhere it will make a sense. Okay, remember that. That's it. Thank you so much everyone. That is the all about this one. ROP screening, someone is asking. Yes dear, ROP screening is done at 32 weeks of life or 4 weeks postnatal age, whichever is later, 4 weeks postnatal age. ROP screening is done at 32 weeks of life or 4 weeks postnatal age, whichever is later. For example, the baby is 28 weeks who has born just now. So when will you do the ROP? 29, 30, 31, 32. 4 weeks postnatal age means at 32 weeks of life sounds good, I will do it. If the baby is 29 weeker, then when will you do ROP? Normally 4 weeks postnatal age means the baby is 29 weeker, no, 30, 31, 32, 33. So according to this, the answer is coming 33 weeks. So 33 will be better because it's, I'm saying whichever is later. So this is later, no? So 33 would be a better answer. I hope you understood. Perfect. Thank you, Osama. Thank you, Mansi, Raccoon, Priyanka, and so many million people who are watching this show. I hope you are good. And remember, होमवर्क है, ओसामा बताएगा अगली क्लास में. कैरी कूम्स murmur in seen in which condition? Continuous machinery murmur we saw in PD. Okay, Carey Coombs murmur you seen in which conditions? And also one more question, Rushkind procedure. Very beautiful question. Rushkind procedure is done in which condition? For every class in the end, I will give you homework. And if you really are genuine, you will come to the next class and tell me the answer. So the homework is Rushkind procedure and the homework is Carey Coombs murmur is seen in which conditions? Tomorrow we have back-to-back classes, beautiful classes we have tomorrow. And even this week we are joining with Dr. Vipul, Obs Gynae. We are doing a beautiful integrated study for pediatrics touching with obs gynae. Like he will tell us the stages of labor and I'll tell you regarding cephal hematoma and stuff connecting with the obs gynae. So very beautiful class is going to be on the Unacademy app. Everything is synchronized. All special classes of mine are very well put with the time and slot and everything. Open Unacademy, type Anand Bhatia, follow and see what all special classes I have posted. Thank you so much everyone for this wonderful participation. Have a wonderful good night ahead. कल मिलते हैं शाम को with a very happy smile. Thank you.